The Zimmer Institute is not just a physical location where cutting-edge concepts and ideas flow freely. It is also an embodiment of quality, which will help position us as the dental implant company of choice. This value-added educational forum, in conjunction with innovative and reliable products, distinguishes Zimmer Dental from its competitors. The Zimmer Institute's leading-edge facilities, located in Carlsbad, California, Parsippany, New Jersey, and Winterthur, Switzerland, offer distinct levels of instruction, which serve as the educational framework. At the inaugural Carlsbad facility, attendees learn cutting-edge implantology procedures and techniques above a world-class manufacturing facility, which produces Zimmer Dental's industry-leading implants. Quality and precision are apparent around every turn.
The Zimmer Institute is truly unique. It really offers an opportunity for clinicians not only to learn today's implant techniques and technologies, but because of the mannequins and the way the facility is designed, we can incorporate whatever comes down the pipe, whatever comes along, those clinicians, as far as advances in implantology, clinicians will be able to come to the Zimmer Institute in a very real-life situation, experience and refine those skills that will make them better practitioners and make the delivery of implant care so much better for patients worldwide.
Comprehensive course.
Comprehensive 1 is really designed for practitioners who both place or want to place and restore dental implants. It's a course that they have taken level 1 and they have gotten those basic fundamental knowledge and skills that they need to place and restore, and now they're ready to refine and practice those skills in a simulated patient environment. So in the morning in a Comprehensive 1, they would place implants on a patient. In the afternoon, they would restore that patient. Multiple experiences, multiple simulated patients, multiple days. That's our Comprehensive 1.
The Zimmer Institute's multi-day comprehensive course offers the best of both worlds, combining various concepts from the restorative and surgical courses. In the more basic portion of the comprehensive course, participants will have the opportunity to perform a number of procedures, which may include diagnosis and treatment planning, hard and soft tissue grafting, various scenarios of implant placement.
Comprehensive 2 is designed for practitioners who are routinely placing and restoring implants, but would like to advance their surgical skills and or restorative skills. So it's a more advanced comprehensive in that it's both surgery and restorative course.
In the more advanced portion of the comprehensive course, area of emphasis may also include open window sinus lift procedures with immediate implant placement, procurement and placement of block grafts, immediate implant placement and temporization, as well as numerous procedures also covered in the basic course component. All of these procedures, both basic and advanced, are taught using autogenous techniques and cutting-edge regenerative offerings such as block and particulate grafts, bone putty, and various soft tissue grafting materials. The restorative focus of the comprehensive courses typically addresses diagnosis and treatment planning, fixed hybrids, and immediate loading of fixed detachable appliances and other prostheses, and bar overdentures for maxilla and mandible. The 3-day comprehensive course is crafted primarily for practitioners who are actively placing and restoring implants. It tends to cover advanced surgical procedures and use of regenerative products, as well as advanced restorative options. Restorative courses.
Restoratively, we have Restorative 1 and Restorative 2. Restorative 1 is designed primarily for clinicians who are working with oral and maxillofacial surgeons and periodontists and would like to learn how to restore basic implants. These courses focus on diagnosis and treatment planning of simple, non-complicated cases such as single units, mandibular overdentures, etc.
The basic course is designed primarily for referring general practitioners who desire to obtain a basic level of competency in restoring non-complicated dental implant cases or would like to refine their skills and learn other basic restorative techniques in conjunction with their surgical specialist. Key areas of emphasis during this introductory restorative course may include diagnosis and treatment planning, impression techniques, temporaries, single unit restorations, abutment selection, patient-specific abutments, mandibular overdenture with attachments, and more.
We also have a Level 2 restorative course. The The level 2 restorative course is designed again for clinicians who are going to be working with oral and maxillofacial surgeons and periodontists and are really comfortable restoring basic or fundamental implants, but would like to advance and do more complicated. So these courses focus on diagnosis and treatment planning, more complicated cases, and might involve like restoring with mandibular fixed detachable appliances or immediate loading in maxillary and mandibular edentulous cases, etc.
The advanced course is developed primarily for referring general practitioners who understand basic implant restorative techniques and would like to refine their skills and learn other advanced restorative techniques in conjunction with their surgical specialist. It aids these participants in taking their skill sets to the next level. During the advanced restorative course, attendees are exposed to such things as diagnosis and treatment planning, concepts of socket preservation, fixed hybrids, and immediate loading of fixed detachable appliances and other prosthesis, and bar overdentures for maxilla and mandible. Advanced surgical course. The Zimmer Institute surgical courses are expertly designed for the surgical specialist who is actively placing implants and would like to extend and/or refine his or her surgical skills in performing more complicated implant procedures, particularly with regard to regenerative techniques and immediate implants. The course's sponsoring faculty designs the specific course. Key areas of emphasis during the surgical course may include sinus lift procedures, both open and closed techniques with simultaneous implant placement, as well as the procurement and placement of block grafts, ridge splitting, soft tissue grafting, treatment of peri-implantitis. All of these important procedures are taught using both autogenous techniques and Zimmer Dental's state-of-the-art implant and regenerative offerings, including block and particulate grafts, bone putty, various soft tissue grafting materials, and placement of the tapered screw vent and Zimmer one-piece implants.
In summary, I think that the Zimmer Institute is a unique experience, unparalleled anywhere else in the world for learning implant dentistry. It's a place where clinicians get to refine their skills. There's nothing that leads to competence and refining skills more than repetition. And when you have instructor-facilitated repetition in a very controlled environment, you're going to get better. This is not to take the place of cadavers or didactic instruction or HIM. It's something in addition to that. For instance, cadavers, a great educational opportunity. Very expensive, but very unique. I might have an 80-year-old specimen, and the person next to me has a motorcycle accident that's 35 years old. The anatomy that we have is completely different. I might be having trouble doing my surgical procedure. This other person seems to be having no problem at all. Is it a reflection of my ineptness, or is it a reflection of my cadaver? I don't know. The instructor doesn't know. In the Zimmer Institute, everybody is doing the exact same patient, so that as an instructor, I can evaluate one student versus another and help those who need help. As a participant, I can look around and see, are my skills better or worse than my peers around me? And it gives me feedback instantly on how I need to develop my education or how I'm progressing. Very unique, very realistic. An experience, an educational experience that, in my opinion, is unparalleled in the world.